Hey everyone, we have a new video in our series about describing illness and injuries or going to the doctor. And in this video, we're going to focus more on physical injuries or issues. In the last video, we looked more at infections or diseases and the issues caused by that, like colds and flus. So here we're going to look at specific but common physical injuries. We'll also look at some serious injuries, and I'll give you examples of how to use these in real life sentences or how to explain it to a doctor. We had this picture in the last video. It's just to show common areas of the body where people get hurt. You can pause the video if you want and just have a look at it to remind yourself. And this is my first set of injuries or issues that I want to teach you today. This is called a sprained ankle or rolled ankle. You can use either word, both are used very commonly, so pick whatever word you find easiest to remember. And this is when you're walking or running and you fall to one side and you bend your ankle too much and it hurts a lot. Maybe it's hard to walk afterwards. And related to a sprained ankle is hurt tendon or some sort of tendon pain. Tendon is the part here of your body that connects muscle to bone, and it's very common. If you sprain your ankle, you will hurt the tendon. If you injure your knee, quite often you will hurt a tendon as well. Next we have pulled muscle or strained muscle. Again, pick whatever word you find easiest to remember, and this is common when you are playing some sports or maybe doing stretching and all of a sudden you feel a pain in the muscle, and this pain will last for a few days. It's called a strained muscle. And the last one isn't really physical, but it's quite common as well. It's feeling dizzy or lightheaded, especially when you're sitting down and you stand up very quick, you feel lightheaded. And here are my examples of how to use these in real sentences. So this is the sprained ankle. You can give a scenario of how you did it to the doctor. I fell over on one side and sprained my ankle. I hurt a tendon in my knee playing sports. Obviously, when you're talking to the doctor, you want to give him or her as much information as possible so they can diagnose you properly. And this one here, I pulled a muscle or I strained a muscle in my leg while stretching. And then the very last one, I get dizzy or I get lightheaded when I stand up. And this is our last set of injuries I want to explain. These ones are more serious, so hopefully you won't have to use these, but they're good to know anyway. I'm sure you know this one anyway. Broken bone, not good. This one here, quite nasty. It's called dislocated bone. In this case, a dislocated finger. And if you look at that word dislocated, the word located, you might think of location. It is where something is. And dis is normally a negative prefix of something is wrong. So dislocated means something is in the wrong location. So if you look at this finger, it's not where it should be. And this is called dislocated finger. Next we have muscle tear. Whenever there is a rip or tear in the muscle, you'll normally get a lot of bruising. And then the very last one, not so serious but quite annoying, is called joint pain. In particular, in this image we're showing the knee, but this can happen in the hip or the shoulder, elbow, neck, anywhere really where your body moves, and this is called joint pain. So to explain these in real sentences, we'll look at the first one. I fell and broke my arm, or broke a bone in my arm, leg, foot, any one you want to use. Next we have the dislocation. I dislocated my finger, my knee, my shoulder. You can also dislocate your elbow. Normally it's very easy to see if you've dislocated something. It looks disgusting. I fell and tore a muscle in my leg. That's past tense. You can use different tenses. You can say I have a muscle tear in my leg instead. And then finally we have muscle pain, or joint pain, sorry. I have joint pain in my knee when I run. Or joint pain in my elbow when I bend it. And that is the video, everyone. Thank you very much for watching. In the next one we're going to give more examples. Maybe I'll do a role play between doctor and patient just to help you guys understand. So thank you very much for watching, and goodbye.